Gregor Baci, a medieval injury and what it reveals about the brain. Some of the most striking insights into the brain come from extreme injuries that people somehow survive. These cases show not only how vulnerable the brain is, but also how resilient it can be. One of the most remarkable historical examples is that of Gregor Baci, a man who survived a devastating brain injury in the early 16th century. Gregor Baci was a Hungarian nobleman and soldier, believed to have lived in the early 1500s. His case is known primarily through a famous Renaissance painting, which shows him with a lance piercing through his head. The weapon appears to enter through one side of his face and exit through the top of his skull. What makes this case extraordinary is that Baci did not die immediately. Historical accounts and artistic records suggest that he survived for some time after the injury, possibly even remaining conscious and able to interact with others. From a modern neuroscience perspective, this raises an important question. How could someone survive such a severe injury to the brain? The answer lies in the structure and organization of the brain. Not all brain regions are equally vital for immediate survival. Basic life functions such as breathing, heart rate, and consciousness are largely controlled by deeper brain structures, particularly the brainstem. If these areas remain intact, survival is possible even when large parts of the brain are damaged. In Baci's case, it is likely that the lance passed through areas that, while important, were not instantly life-sustaining. The injury appears to involve parts of the frontal and possibly parietal regions, rather than the brain stem. Damage to the frontal lobes is often associated with changes in personality, decision-making, and behavior. Individuals with such injuries may show altered emotional responses, reduced impulse control, and difficulties with planning. If Baci survived for any length of time, he may have experienced changes like these. There is also the possibility that the path of the lance avoided major blood vessels. One of the most common causes of death in head injuries is severe bleeding. If the object missed critical arteries, it could have reduced immediate fatal risk. Another factor is infection. In the 16th century, infection was a major cause of death following injury. Even if someone survived the initial trauma, they often died later from complications. This makes Baci's survival, even for a short period, particularly remarkable. From a neurological perspective, this case highlights the idea that brain function is partly localized, but also distributed. Some areas are critical for survival, while others are involved in higher-level cognitive processes. Severe damage does not always lead to immediate death, but it can lead to profound changes in behavior and cognition. Baci's case is often compared to later, better documented cases such as Phineas Gage, where damage to the frontal lobes resulted in dramatic personality changes. Although we do not have detailed behavioral records for Baci, his injury suggests similar possibilities. However, it is important to evaluate this case critically. Unlike modern case studies, Baci's story is based largely on a painting and limited historical records. We do not have medical scans, detailed observations, or systematic documentation of his behavior. This means there is uncertainty about the exact nature of the injury and its effects. The painting itself may contain artistic exaggeration. Renaissance artists sometimes enhance dramatic features for symbolic or aesthetic purposes. This means the exact trajectory of the lance may not be perfectly accurate. Because of this, Gregor Baci's case should be treated cautiously as historical evidence rather than definitive scientific data. Despite these limitations, the case remains powerful. It provides a vivid illustration of how the brain can sometimes withstand extreme trauma. It also highlights the importance of specific brain regions in survival and behavior. More broadly, it reminds us of a key principle in neuroscience. The brain is both fragile and resilient. Small changes in certain areas can have major effects, while even large injuries can sometimes be survived, depending on their location. So what is the key takeaway? Gregor Baci's case shows that survival after severe brain injury depends on which areas are affected. Damage to higher cognitive regions may alter behavior and personality, while sparing vital structures can allow survival, at least temporarily. At the same time, the case reminds us of the limits of historical evidence. Without modern data, we must interpret it carefully. Even so, it offers a striking glimpse into the relationship between brain structure and human life. So the next time you think about how delicate the brain is, remember this. A man in the 16th century survived with a lance through his skull, and his story continues to remind us just how complex, vulnerable, and resilient the human brain can be.
If you enjoyed our channel, please click subscribe